So let's talk about something that's quietly changing, well, everything: artificial intelligence. It's not just in our phones or our cars anymore, it's moving into some of the most personal, most human spaces imaginable. I'm talking about mental health, about the very practice of therapy. So, what happens when an algorithm sits in on the session?
I know, it sounds a little bit like science fiction, right? But this isn't a what-if scenario for the future. It's becoming a reality right now. And it brings up some massive questions about things like trust, responsibility, and what it even means to care in the first place.
And that's the thing you've got to get. AI is already here, it's in the room, and because of that, it's creating this brand new landscape of challenges that the counseling profession has to figure out how to navigate, like yesterday.
Now, we're not talking about a robot sitting in the therapist's chair. Not yet, anyway. It's much more subtle than that. It's about the tools therapists are already using: software that helps them take notes automatically, platforms that assist with client assessments, or programs that can even suggest treatment plans. These things are all designed to help, of course, but they add a layer of complexity that we've just never seen before.
And this, right here, is the heart of the problem. The ethical codes that counselors rely on, the ones that guide their entire practice, they were all written for human-to-human interactions. They simply don't have a playbook for what to do when an algorithm gets involved. This creates what you could call an ethical gap, leaving us trying to figure out brand new dilemmas, like what to do about algorithmic bias, or who's really accountable when a piece of tech makes a recommendation.
So, how do we bridge that gap? Well, the answer isn't necessarily more rules or another new technology. It's actually a fundamental shift in perspective. It's a framework that puts the human relationship back where it belongs, right at the center of everything. And that framework is called care ethics. Now, it's not a checklist of do's and don'ts. It's a philosophy, one that's been adapted from feminist moral theory. And what it does is it prioritizes the messy, real-world context of relationships and our responsibilities to each other within them. It's really about thinking critically and with intention, not just blindly following a rulebook that's out of date.
And you should know, this isn't just some abstract idea. This specific framework was carefully adapted for counseling by Dr. Michael Jones, building on the incredible work of the philosopher Joan Tronto. So it has a really solid academic and clinical foundation, designed specifically for the challenges that therapists are facing today.
Okay, so what does using this framework actually look like in the real world? It all boils down to 5 core principles that are framed as questions. Think of it as a kind of ethical compass that you can use to find your way anytime you encounter a new piece of technology.
These are the 5 points on that compass: attentiveness, responsibility, competence, responsiveness, and trust. Each one is a question a therapist can ask themselves to make sure they stay grounded in what truly matters. Let's dig into each one. First up is attentiveness. This is all about asking, how is this tool changing my presence in the room? Am I looking at a screen instead of my client? Is my client maybe holding something back because they know an algorithm is transcribing what they say? It's all about staying tuned into the very human dynamics that technology can so easily interrupt. Next up, responsibility. And this one is absolutely crucial. When an AI tool suggests a certain course of action, who's ultimately accountable for that decision? The tech company? The coder? Nope. The answer has to be, always, the clinician. This principle is a firewall against blaming the technology. It ensures that human, professional judgment always has the final say. Then we've got competence. And this isn't just about knowing how to click the right buttons. It means really understanding what a tool can do, and maybe more importantly, what it can't do. Can you spot when its suggestion is biased, or maybe just flat out wrong? That's the true measure of competence here. Fourth on our compass is responsiveness. Look, technology is often designed for efficiency and one-size-fits-all solutions. But therapy is the exact opposite. It's all about the individual. This principle asks if you're putting the client's unique needs, their culture, their context, ahead of the sheer convenience of the tool. Are you willing to ditch the tech if it's not right for this person? And finally, we land on trust. This might just be the most important question of them all. The entire therapeutic process is built on a foundation of safety and connection. So the bottom line is this: does using this technology build up that trust, or does it chip away at it? If it weakens that bond, it doesn't belong in the room. End of story. Okay, so that's the compass, that's the theory, but how does this all translate from an idea into the actual day-to-day work inside a therapy room? Well, the great thing about this framework is that it's designed to be a super practical tool for everyone in the counseling field. For students, it helps build a strong ethical core right from day one. For counselors already in practice, it gives them clarity on the tools they might already be using. And for educators and supervisors, it gives them a concrete way to teach and model how to integrate technology thoughtfully. And one of the single biggest dangers this framework helps you navigate is something called algorithmic bias. See, an AI learns from the data we give it, and our world, as we know, contains biases. So, for example, if an assessment tool is trained mostly on data from one demographic, it might completely misinterpret the experiences of someone from a different background. Without a critical human eye, these systems can actually end up amplifying harm and perpetuating stereotypes. And this is where the framework becomes so practical. Thinking through these 5 questions leads to real-world actions. It pushes you to create a clear, informed consent process, to actually talk with your client about how their data is being used. And it empowers a clinician to confidently say, you know what, that AI suggestion doesn't fit my client's life, and to trust their own hard-won clinical judgment instead. When you zoom out for a second, you start to see that this is about so much more than just professional guidelines. It's about building a whole philosophy for how we can approach technology with a conscience. There's a quote from the source material that just says it all perfectly. Relationships come first. Technology should serve therapeutic relationships, not replace or diminish them. That's it. That's the whole game. The goal isn't to demonize technology. It's to make sure that it always serves the human connection that makes therapy work in the first place. And that, right there, is the ultimate takeaway. Because even though this framework was designed for counseling, its principles apply, well, everywhere. It's a model for how we can integrate any new technology into our lives, in any field, by first stopping to ask how it impacts our relationships and our deepest human values. Which leaves us all with one final, pretty powerful question to think about. As our tools get more and more intelligent, the real challenge is for us to become more thoughtful, more intentional. In an age of AI, what does it truly mean to care?